All right.
Yes, doctor.
So the reason I wanted to do a session, first of all, I finally got some time off in between the week when I wanted to do more of these kind of sessions, but it's just I get time limited or restriction with time. But I know a lot of people who have applied to Capit, they got, some of them got invites, some got interviews, some got accepted, some are waiting. And I think right now in June, and this is a time where most of the schools on like New York UIC have pretty much done with their interviews or are doing it. And now in a month you will see that other schools like USC, UOP, UCLA will start sending their invites, and Colorado is going to start their session all over again, like the admission. And there are a lot of people who haven't gotten the success they wanted or are still trying to figure out some problems and trying to sort out things. And I wanted to do like a Q&A session where I can help you guys, or at least give you some feedback I've seen, or whatever my suggestion I can provide to help you guys. So this is an interactive session. I'm more than happy to answer your questions. If you guys have any questions, we can start off from there, and then I can share some ideas which I've been hearing a lot and which might help you. So if somebody has any questions or anyone want to discuss something, you guys can ask me right now. And here's the other thing I'll say: at the end of this session, I would stop the recording session, and if you would have any other things that are a little bit more in depth or personal, or you want to talk off the recording, we can also do that afterward. But do you guys want to ask any questions from your current profile or situation, or any problem that you're dealing with Capit right now and trying to find a solution? Does anybody has any question? All right, that's okay. That's very quiet. Okay, so
Doctor, sorry, I have a question. This is my second cycle for the Capit. Maybe I was not very much prepared for first cycle because I was more indulged in Canadian universities. I got waitlisted from one of Canadian universities, so this cycle I'm applying to US. So I have few questions about on first one is UIC. They didn't say it on their site or anywhere that they don't accept international students. So I applied, but I never heard back from them. So what is their criteria about the international students? Because they don't say it in written anywhere. I tried to confirm few people, but there's nothing.
So what I've heard from my experience, or when even I was applying, they kind of this one way or another, what I've known is that they prefer people who already have an existing visa for US. So they don't want to give. So here's what you need to understand: when schools give you an F1 student visa, they have to set up a separate office which deals with the Homeland Security Office. And it's a lot of paperwork, it's a lot of responsibility to deal with international students. And some schools, especially the coast, are very open, like New York and California, Miami. Like, these people are very open to immigrants. They are used to of international students, so they are comparatively more open. The more you come towards Midwest, like inside, like if you look at the US map, these are landlocked area. Even Colorado is a landlocked area, and they are a little bit, I think they get less immigrants, whether it's Ohio, Indiana. Well, Chicago has a lot of immigrants, but overall, this area are not much open, like Alabama, to immigrants. So yeah, their office, like to answer your question in short, UIC, from what I know, does not offer F1 student visa to people. Now it might have changed.
Problem is, like, for Canadian Canadian citizens, we don't need visa to enter US, right?
Well,
so basically, I don't have any visa, but
again, I'm not a very big expert when it comes to visa policies and stuff, because they keep changing. So if they are not, if I was you, once their process is done, you should email them. All right, that should help. The second thing is, I would even next year they have like a visit campus tour or something like that. You can visit them. The third answer somebody can answer you is if there are current student, you can just ask them, is there anybody who's Canadian? Because again, you might be Canadian, you might not need a visa, but the school only prefer people who are American or have American visa. All
Okay.
right. So yeah, so but to be honest, if you're applying for this program, I applied to God knows like 12, 15 schools when I was going through this. I don't know
I
about six,
applied to like 13 of them.
yeah, 6, 7 didn't even reply to me. And you can't, it's not like if I don't get married to this one school, I will commit suicide. So it's like if I just apply, how many, like you can't bound yourself just because UIC is not sending me a reply or answering me, like my whole system is blocked.
Yeah.
You gotta keep applying to other school. And to be honest, this is a very competitive process, and beggars can't be choosers. So we don't have really much of a say. They don't even reply to us most of the time. And it is what it is. You work on your application and you start applying to other school. Here's an advice I scream on top of my lungs. I tell everybody before the Capit starts, before March, these offices are very easy, laid back. These they act like average human. You call them, you talk to them, you visit them. They will be very nice to you. But
Mhm.
right after March, they become Hollywood stars. Then it's not that they throw tantrum, is that they become so busy. Imagine
Yeah.
if you get hired as a in this office, and after March you realize there are more than 800 to 1000 people emailing you from all around the world and
Mhm.
writing you in ways that are like even the English doesn't make sense, and
Yeah.
asking you the most stupidest question which are already on the website. So they get so much overwhelmed with these kind of things that at that time they become very specific or choosy in who we're going to reply and who we are not going to reply. And trust me, it's not like if I email the dean and say, hey, the admission committee or the admission officer at UIC is not replying me and I want to file a complaint against them, they don't even care, because they know how much this person is overwhelmed right now. Does that
Okay.
make sense? I'm just
Yes.
trying to make you understand from the other side of the picture.
Yes. Yes. And also, the other thing is, I really like the way you always do that part. Like you get all the info about a person, and then you give an introduction. If you can do it for me, that will be great help.
What was that? Can you ask me again? Sorry.
Uh, in your last webinars, the recorded ones, I saw like you get all the info about the person, and then you just give a brief introduction, like how you present yourself and tell me about yourself question.
Mm-hmm. Mm-hmm.
So, are we gonna do that today, or it's not a part of thing today?
I can do that. We can do that, and I'll send you a $2,000 bill afterward. I'm joking. We can do
No,
that. Okay.
I don't. I'm
I'm
already
joking.
in your contact about that thing. Whenever
Okay.
I'm getting my
Oh,
interview, I'll do
let's.
that.
Here's the thing. I'll. No, no, no. It's. I'm. What I'm saying. We can do that. Let me take somebody else's question, and
Sure.
then I'll come back to this and talk to you about that. All right.
Oh,
So, Dr. Minna, I think you wanted to ask a question. If I'm not looking at the chat, can you guys just unmute and speak in between? So, Dr. Minna, you said something. I have a question about supplemental questions, Doc. What should we write when they ask about any factors that have had negative effect on some aspect of your academic? So, Doc, I don't know your profile. I Can you unmute and talk about this? Because how can I tell what's the negative effect? Okay, I presume she's busy right now. Dr. Mina, whenever you're free, you can speak. But she asked this question that how can we say something like they she's asking the question, is my voice echoing back? Okay. So she's asking if that what should we write if the school asks about any factor that had a negative impact or effect on some aspect of your academic performance. So I don't know exactly, but I had worked with a lot of different people in the past who come from Middle Eastern countries. There was war going on in their home country. Somebody lost a family member during COVID. Somebody had like other personal issues, financial issues. So it depends. It varies from person to person. So yes, if there has been something significant that has affected your Capit application or your GP or something, you can discuss it in your personal statement or resume. All right.
Doctor, I
Yes.
had a question.
Yes.
Doctor, I've heard that it's very there's a mixed notion about if it benefits people if you apply early or late. Can
No,
I?
there's no
Yeah.
mixed notion about it. Okay, let's tell you. For example, you you work in a you work in an office, in a school office, right? You're one of the faculty, you're a dentist, like you work in their office, uh you're an admission committee person, and your process start in March, and by June you need to have acceptances and you need to have 40 students ready. You have to compile or gather all of their background check. You need to have their academic record. You need to have their criminal records. You need to make sure they are financially ready to pay first semester fee. So the school understand from that perspective that if you are working in the school in the next 5 months, there's a pressure on you to have 40 people ready that are willing to pay $60,000 right away, whatever the first semester fee would be, who have the visa to come to US and like who won't drop out of the school right away. All right. So it's your job as admission person to do all of these things in the next 3 months, which will require a lot of communication, a lot of paperwork. You have to prepare the faculty to take interviews, collect that, do bench exam. Like there's so many things these guys have to do. And I've never worked in an admission committee, but I've talked to people from different schools who does it. And trust me, it's not a good place to be in. It's like a very hectic season for them. And when in all of that process, there is one or two candidates who's applying on time, who's providing all the documents, who know how to speak and behave professionally with respect, you are somebody who's helping them in this process. You were very direct and upfront that I'm applying early. I'm interested in your school specifically because I can move to Colorado or NYU or whatever that school is. So you're helping them. So when you're saying there is a mixed review about applying late or early, there's no mixed review. The earlier you apply, the more organized you are, the better you communicate. You're actually helping the school in this process if you're a good applicant, and they will like you. So I don't think, unless you have something serious going on and you weren't planned on time, it's always better to apply as soon as you possibly can as humans. I know there's certain problems going on, certain paperwork, exam, but apply as soon as possible. Like just most of you guys, I think, have come to US. Like I believe the younger you come to US, the earlier you will integrate in the system and you will understand what's going on. The later you will come, the older you are, the more stamina you need, the more flexibility you require. So in the same way, the earlier you apply to school, the better it is. Now, can everybody apply on the first date? No, because you have a lot to deal with. You have to manage those things. So, but whatever you can, like the earliest you can, apply soon. Does that answer your question, Doc? Dr. Kusum, I think, if I'm...
Yes, sir. Yes, sir. Thank you.
Sure. Any other question, guys?
Hi, Dr. Adriel.
Yeah. Yeah, sure.
So my question is, like many schools, they ask you about to mention the gaps if you had any. So what would be the best way to explain a gap? Like I had a gap when I was moving to United States. Like before that, when I left the job and I was going through my visa process. So I was not working at that time, and I have some gap which I had to explain in my many of my applications.
So how
So
long
I'm
was the gap?
it was like less than a year, but more than 6 months. So I think I have to explain that. Um,
Was it in one go? Like your gap is in one go, or
yes, like if I have to say, like if I was working, no, I wasn't working as a dentist during that time. So
it's
that's
fine.
why.
Okay, here's the thing. I don't know if I told this somewhere or you heard it or not. Like I had somebody who got accepted to University of Tufts when I started off making YouTube videos back in 2019, and she had a 8 years of gap. She was from India. She came to US, took care of her family, had kids and everything, and for 8 years she didn't do anything at all. And then she gave her boards and got accepted, and now she's a graduated doctor, a DDS. All right.
Yes,
So
yes, doctor. Yeah.
so the number one thing what I'm trying to tell is that it's normal. It's totally
Okay.
fine. Okay. And 1 year gap isn't really even a big gap. So you can mention that during this phase. Now it depends on how you write, how you express. Like sometimes you can tell, like you can mention that during this phase I was studying for my national board exam and I migrated to US and I was sorting out my visa and studying for my exams during that time. I usually have candidates who have 4 or 5 years of gap because they were mothers. That's the amount of gaps I see, which then we have to write down or figure out. And even that is fine. They know, like a lot of candidates who are applying are female, have kids, and obviously when it comes to your kid, your profession becomes secondary. You're moving to US, which is not easy, and managing kids and family. And some of the people have kids with special need or other issues, or had to do a lot of moving and had to deal with some sickness or something. It's never a bad thing as long as you can tell that during this time I was doing like whatever I was capable of, I was doing something good out of it. That's what matters. It
And
wasn't like
is
a,
it
yep.
yeah. And is it a great idea to mention that in your statement of purpose, like being
I
upfront?
think it again. But now, if I ask you, is it good to put a specific salt in your dish or specific spice? Yes, but it depends on what the person like. It's fine. You can talk. You can put 1 or 2 lines in there, but personal statement is a whole life story, right? So uh, you can always put 1 or 2 line where you want to discuss this, but rest of the stuff in the personal statement should be good as well. Like when we are talking about a dish, like a whole dish, there are 700 ingredients in a dish. In the same way, your personal statement will have a lot of different aspect of your story. Now you want to see which one are the important ones, because you won't be able to cover everything in your personal statement, so you have to prioritize. Like how that doctor was saying, like about uh, when I talk to people about, they tell me about yourself. If few of you or somebody and you have worked with me, so what I do, I listen to their story and I try to figure out what's the most important part in their life and try to create a tell me about yourself out of that. So your personal statement is kind of like a trailer out of your movie. Like so if you feel like this is a very important thing and I can give 1 or 2 line, do it. Yes, you
Okay.
can. But if you have something more important to say, don't rub that off and put this in. Does that make sense?
Yes, doctor. Thank you so much.
Sure, sure. Any other question, guys?
Hi, doctor. I just want to ask a follow-up question to Mansi. So she was talking about if there are any gaps. So what does gaps mean? Does gaps mean not being in dental related field, or if you were pursuing any graduate program, or if you are working, is that still considered as a gap?
No, it's not a gap.
Um,
That's not a gap. The gap means like when you gap, it's a subjective, stupid thing, to be honest. We are all human beings, we are all grown ups. Gap means that so gap year is it's a very American concept. So what happens, people who local American students, what happens like in future, if you have kids and stuff and they grow up in US, what happens, they go to high school, they go to undergrad, and for 1 year the kid goes for a mission trip in Brazil, or for 1 year he plans not to study. This is very common in American students, like the local kid. For 1 year they just plan to work in a Starbucks or go and travel the world or do some dental assisting. So they take a gap year from their education. Does that make sense? So
Yeah,
that's what they, so gap year in our context is, if you have like you graduated in 2013, then you did a master's, and then in between you don't have anything to say that in your resume, that's a gap year. Now how do you fix it? In your personal statement you mention what you were doing during that 1 year.
Mhm.
So what you were doing a master's or education, that's not a gap year. You were doing something academic. So so gap year is a relative term for resumes.
Okay.
Does that make sense?
Yes. Yeah.
All right.
Thank you.
Any other questions, guys?
Hello, Dr. Adriel. Thank you for conducting this webinar today. I just wanted to ask regarding when we're applying to different schools, and I know that they don't show it upfront on their website, but how do we get to know about any university, whether they are on a rolling basis or if they wait until all the applications come in and then they decide to start sending the interview invites? And also I wanted to know in how much of a role, because each university had their own follow-up questions. Some universities don't, some do, their own personal statements. So when they are reviewing, how important is our Capit SOP to, let's say, whatever their individual
Can you,
questions are?
Dr. Kainat, can you tell me a little bit about your profile, like your academic profile? When did you graduated and what you're doing right now?
Yes. So I graduated in 2020 from my dental school, after which I worked for a year in it's like a government house job that we do in India. So I did that in a government hospital for a year, after which I moved to Canada to pursue medical biotechnology. I wanted to know more. That time COVID was going on, and I was more interested in the research and biotechnological aspects of medicine. So I went there, I completed the program, which was completed in 2022, during which I volunteered at hospitals, volunteered at a dental clinic, and also did some research with my professors. Following graduation, I have continued to work on my profile, give my TOEFL, my INBD, and 2024, this cycle is my first cycle that I had applied,
Okay.
and
All right.
that is basically yeah.
The reason I asked this is just to understand your background a little bit, from where you're coming and your experience. So, number one rule, okay, if you people, this is a different example I have to give, but people who got gun training, they teach in gun training is that you treat every gun as loaded. All right. So whenever you hold a gun, you treat that gun as loaded. In our profession, in dentistry, they say treat everybody like they have HIV, right? Like that's how you protect yourself. In the same way, number one, if you want to make your life easy, treat every school as they are rolling. Like so that way you're going to apply early to everything. You don't want to be like, okay, let's see, this school isn't rolling, I'll wake up after a month and then apply. Maybe in a month you might get sick, I'm just saying, God forbid, or you have visa issues, or you ran out of money, or you have a car accident. Like, I'm saying all of these things because they have happened to me. Like, whenever I put something on pending, like, I'll do it and be lazy. I'm not saying I'm not saying to stress yourself out and don't sleep, but if you can get things done early, better it is, because sometimes your letter of recommendation wasn't signed properly. I don't know how many messages you guys seen on Facebook and stuff every year, and I was one of those guys. that Indiana University emailed me, hey, your letter of recommendation, one of them, your professor hasn't signed it. And thank God to them, even though they didn't give me an acceptance, but they told me about this. So I went back, got it fixed, and resent it to everybody. Otherwise, the school wouldn't have told me that there's a document missing, right? So you want to do it early for every school. So if there's something missing, you would know early on, then they might let you and you can fix it, right? So there's room for error and which can be fixed. That's number one thing. Now, still, if you want to say, as a general rule of thumb, most school won't say we are rolling or not rolling. Very few of them do, because if you, again, the same thing is, if you were working in the school and you have to get done with the process, why do you want to let the students know to send in your document late? Most school prefer to be sent everything on time and everything. The only place, the West Coast schools like Californian school, UCLA, UOP, they say they are not, like they officially say that they are not rolling. So if you want to know, like most of the non-rolling schools would be towards California. But where I'm sitting now, looking at the process, treat every school as rolling. Apply soon. Don't wait. Something will happen. I'm gonna give you one example. I never got an invite from Loma Linda, even though I applied, because they wanted my transcript to be sent from Pakistan, from my home school, and I got it sent by DHL, and this was COVID, and it never reached. So I spent all this money and time applying for documents, and there were so many damn questions I had to write answers for. And I did all of it, but the documents didn't reach on time and the deadline passed. So all my hard work went down the drain. I'm just sharing an example. So don't rely on rolling or non-rolling, because they might want something and the documents from these countries take million of years to reach US, right? Or somebody is not sending emails. So most of the non-rolling schools are on the like Californian schools, but even I would say treat them like they are rolling. Apply soon.
Okay. Thank you, Dr. Adriel.
What was the other question you had, Doc, beside this?
Yes. So we do have a Capit statement, and then there, like you said, Loma Linda had a bunch of questions, and every school had their individual follow-up questions. So when we are applying, and they ask specific questions, which we might have addressed already in the Capit statement. Yep. For those questions, do we rewrite it again in a different manner? Do they even see our Capit statements, or do we treat those questions as like fresh questions with new stories? So everything.
Here's the thing I'll tell you: these schools, I personally feel it's overall dentistry right now is a very big business. Like I'm gonna take you a reverse picture. Like I'm gonna make you look at things from a different aspect. Right now, dentistry is a very big booming business. I don't know if you guys understand, like Fortune 500s or like US is owned and run by business lobbies, very big business like Warren Buffett, like Rockefellers, like big business families. So recently, over the past 30, 40 years, what they did, these business people figured out, oh, there's a lot of money in healthcare, in medical field, and these doctors are too dumb to understand because they keep studying the human body. So they don't understand business. So why don't we go and buy out these medical centers, these hospitals, and generate more profit? So that's what they did to the medical side. Then over the past 20 years, they have done similar to dentistry now, that usually in the past, dentistry was run by dentists. All the lobbies, all the businesses, all the practices were owned by them. But now these big companies have jumped in who have bought out dentistry, and it has become a very booming business. But in order to make millions of dollars in dentistry, you need a person with a license, a dentist. And what they do now, dental schools know this, business lobbies knows these, banks knows this, government knows this. So every year they are making it more and more difficult to get accepted into dentistry. They are making it more competitive. Have you guys ever thought, why do they need foreign trained dentists like me and you to come out of their country and come to US and make all of this money? The reason they have opened up these doors, because the local students don't want to do it. It's too much time, it's too much energy, and then we are already half cooked dentists. Like, we are already pre-prepared dentists. All they have to do is put us in the oven for 2 years, and then we are good to go and practice. And there's a shortage of dentists in US right now. So the point I'm saying, now coming back to your answer, because of this, they are making getting accepted to dentistry more and more difficult. It's more easier to get accepted to a med school in US than to get accepted to a dental school. And for that, what they do is they keep adding, you have to give CASPER exam, you have to do this exam, Kira talent assessment, you have to send your documents, blah, 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 all of these things. And now some of these schools have their own extra tantrums. Like, we want a separate personal statement. We want you to send your TOEFL separately, which cost us money when you send extra documents. So now you already submitted them to Capit, you paid once. Now these schools want them all over again, which is a headache for your life. But we have to do it. If they ask you, now answering your question, coming back to it, is whatever they are asking you, you have to provide them information and answer, even though you filled it in Capit, but you have to redo it. No, should you be repeating the same words? No, maybe if you can rephrase things and add a little bit more idea in a smart manner, because you don't want to waste their time too by copy pasting the same thing. You want to rewrite something which might be similar, but you can add more information or use some different words in that. But yes, you have to fill it again and write answers. And I know some schools are very annoying because they require so much extra information which we have already written down in the Capit portal. But what's annoying is they keep making it more and more difficult every year. Like, they are adding more exams and tests and interviews into this. But does that answer this for you? Does it make
Yes.
sense? I know I'm giving a lot of background information regarding it, but where I am sitting now, when I look back things, now I see what's going on. Like, why is this happening? Like, what's the whole issue with, why do they make dentistry so much difficult to get in the first place?
Yes, doctor. Thank you so much.
All right. So, any other question, guys?
Good afternoon, Dr.Adriel. This is Jagriti.
Yes.
Doctor, I had few questions regarding the interview. What type of questions should be asked at the end of the interview? Like, it is said on the videos on YouTube as well that you should ask questions at the end of the interview. So what would you suggest that we should ask to the admission committee or the panel?
So somebody asked this question to Dr. Stevenson. Dr. Stevenson said, and obviously Dr. Stevenson he's a professor emeritus. He's been in the system for way longer than any of us. He said, well, if you don't have a question, don't ask them. Just don't act silly. Like, you know how we script things just to say it? It just makes you look stupid. So if you don't have an honest, curious question, don't ask. Number one thing. If you want to, and sometimes what would people do is read off Google and give just read something on their website, which is right in front of there, and just say that thing. When I agree with Dr. Stevenson, if you don't have a good answer question, don't ask. It's not a deal breaker. Like, just because Dr. Jagriti wasn't able to ask a question at the end of the interview, we will not accept it. Like, that doesn't matter to them. So, but if you want to ask questions, my best, if you actually want to have some question, number one thing is listen to their conversation when they introduce themselves, when they tell you about who they are, what they do. Maybe when you're hearing something, you'll, like right now I'm speaking a lot. Most of you guys who are listening, some question might pop out pop in your head at that given time when you're listening to me? That's a genuine question that popped up in your head. Like, so if you have something of a curiosity that rose when they said something, ask them. But you still feel like, no, I want to ask more. You can, the third thing you can do is reach out to a student who studied there or who's currently studying. Ask them, what are the things the school likes to do? Like, what do you suggest? What would be a good question? Because there are most candidates, I see the trouble is that they read off things on Google and think that's a very, like, whoever is making the website, they write very generic thing. Like sometimes they will say, oh, we do research and we spend millions of dollars on research. Well, not all of that research is happening in dentistry because the university is very big. It has physiotherapy, it has biochemistry, it has medical school. So it doesn't really mean that whatever is written on the website is directly linked to the dental school. So number one, if you don't have a question, don't ask. Number two, if they say something during the conversation which makes you think of a question or makes you curious, ask. Third thing is, if you really want to do some research, talk to the local students who are studying there. They might be able to tell you something which is not on Google and which might create a real question to be asked. Does that make sense what I'm saying, Doc?
Sure. Yes, sir.
Because half of the people in Capit, they are stuck with this issue. What should I ask? Well, nobody cares. Even if you don't ask, if you're supposed to get, if you give a good interview, they will get you accepted. Because here's the thing I'll tell you about interviews. This is a very, very, very important, because if somebody asks me what I love to do, I love to prepare people for interviews. That's what I can do every day, all day. And I tell everybody, interviews, you don't get accepted because you have a lot of knowledge, because they are not looking for faculty, they are looking for students. And if you are a teacher or if you were a college professor, you are not looking for people who know everything, and neither are you looking for somebody who's too stupid to teach. You are looking for a student who's teachable, who's willing to take orders and learn and grow. There is a certain personality type that we like as students. So when you're giving an interview, it's not about showing off how much knowledge I have. I know somebody who sat in an interview, gave his first answer, and the school was saying, like, we don't want people who think they know everything. Like, they said it right away. We don't like candidates or students who think they know everything. So what I'm saying is, you need to mold your answers during interview, especially in the start, that show that you're a student, you're a humble person who's willing to learn. And I'll give you an example. I'm just giving you one example. I can say, I'm from Pakistan, and I was fortunate that I went to a really good school, and I went to a dental school and graduated in 2013. Then I did a exam, pass an exam, got into oral and maxillofacial surgery, which was a 4 years of residency under College of Physician of Pakistan. But I moved to US, did a master's in health administration, and then worked for 2 years with a non-profit organization. Right now, I'm saying this. Now, on the other hand, I can switch my words. If I'm talking to a school faculty, I would say that I was amongst the fortunate who got accepted to a really good dental school where I got to learn about a lot of surgical procedures. I got familiarized with oral medicine. And during that time, a lot of my faculty encouraged me to pursue excellence in dentistry and pursue advanced education. And that ignited a fire in me to pursue oral and maxillofacial surgery residency in Pakistan, which laid down a good foundation about medically complex patient. But I personally felt there's more to life. I'm echoing for some reason. I personally wanted to so I would say that I wanted to learn more about dentistry. I wanted to improve my horizons. So I got the opportunity to get enrolled in a master's program where I got to learn about health administration in the United States, about their insurance system. And I got to learn about professionalism. I got to learn how to communicate with my faculty and peers. Now, when you go back, when in the recording you will listen to this, in between the two answers, I'm saying the same things, but the way I'm phrasing the word in the second one is you want to show yourself that it's not about what I did. It's more about what I learned when I got the opportunity to do something. So you're not showing off or telling them, look at me, how much of a big dentist I am. They are trying to see how much of a big or a good student you are. So when you sit in your interview, you want to start using phrases and words that makes you look like a good student. And to answer your question, what I was saying, Dr. Jagriti, is that during your tell me about yourself or during your start 4 minutes, that's when they already create a judgment about you. When you guys opened up this video and started talking to me, you realize whether it's going to be worth it to spend your next 1 hour listening to this guy or not. You might have already created a perception about me, but when you see me on the video and you hear me, you create a judgment. In the same way, every human, every faculty has a bias. In the first 2 to 3 minutes, they create an impression about you. Their nervous system or their subconscious system creates a judgment whether this person will be a good student, teachable for the next 2 years, or is she going to be a headache to keep in the school. And according to that, they write down comments. They write down recommended, not recommended, recommended with reservation, or patient or student had good communication, student lacked critical thinking, whatever their comments are, they write it down, they send it to the admission committee. And the admission committee compiles everything. There's a lot of other things they are looking at: your nationality, your experiences, your clinical, your diversity, all of different stuff. And from there, they send you acceptances. So in amongst this whole big picture, you asking a question doesn't really matter. But what would matter is how you start your interview, the expression or the image you create in front of them, and how they see you. Like that's the most, I tell people in the first 5 to 10 minutes, interviews are like a date. I know this is a very silly example, but interviews are actually like your marriage proposal or your first date. Whether they like you in the first 5 minutes, they will decide it. If not, there's not going to be a second date. So, does that make sense what I'm saying?
Yes, Dr. Adriel, that makes sense.
Okay. So, any other question, guys? I know I'm the reason I'm sharing more information because I know afterward there will be people looking at this recording, so they can have a little bit bigger picture of what this whole process is. So, any other questions, guys?
Okay, go ahead.
No, it's okay. I already took my turn. It's just one other question I have. You can go ahead.
You guys can fight for it. I don't. I'm joking. Okay.
It's okay. You can go ahead. That's fine.
I'll come back to you, Dr. Kaur. Don't worry. I'll get back to you. Yes, Dr. Manshi, go ahead.
So, Doctor, my question is, meanwhile, we are waiting on the schools. So, what else we can do to improve our profile? I know it's a very broad question that I've asked, but maybe a few things.
Have you done research, any volunteer work already?
Yes, that's what, I have tried most of the things and I'm now out
What's your profile like? Quickly, briefly tell me, what's your profile?
So I passed out in 2016 from MCOTS Manipal, and I worked there as a lecturer for 4 years. And I left my job there in 2020. And after that, I started pursuing towards dentistry in the United States. However, before coming here, I worked as a associate dentist at a private clinic. So I have...
How long?
For a year.
Okay.
And then I had that gap that I was talking about in 2022 to 2023. Yeah.
Okay. And then?
Then as I came here, I started working as a dental assistant. I have an experience of around 6 months as a dental assistant. I got my Washington State license to practice as a dental assistant. I volunteered with California.
How much is your TOEFL?
105.
Okay. And you volunteered with what?
Healing California.
Okay.
They have dental camps,
I know.
so I volunteered with them. Yeah, that's all I could do here. So I'm thinking I have mostly applied to West Coast, so they have not
Okay.
started.
How many schools did you apply?
I think I've applied to around 10 to 11 schools.
Okay. First of all, I know your family. I'm gonna give away. So, okay, you when you apply, you have to apply to more school, in the sense that even if you have to apply to East Coast. So my suggestion is, when you're applying, don't bound yourself. Like, here's the thing: as immigrants, if you grew up in Delhi, if you grew up in Baghdad, if you grew up in Lahore, if you grew up in Lisbon, and like whatever your country city was, in most of our countries, we are very bound to our locations. Like, my three generations have been very oriented in Punjab. In Pakistan, we never will go to KPK or far-fetched other part of Pakistan because of the infrastructure of these countries. People rarely move from North India and settle down in South unless somebody's paying them a lot of money. Otherwise, they will love to live in North. So in US, one of the things you need to understand, I was reading this, US has one of the most number of billionaires in the whole world because of its size, because of its massive size. US is such a big country that there's a lot of opportunities. If Texas put you under a criminal, something like that, you can actually go in a different location and start reliving your life. That's so. Yeah, I'm not saying to be a criminal. What I'm trying to say is that it's a very big country, and you have to think like an American if you want to pursue opportunities up here. And number one thing is, you can't bound yourself geographically, at least when you start off. When you're applying, you want to apply everywhere, wherever you can, wherever you see the most number of seats. Obviously, finances are a limitation. That's the number one thing. Once you get acceptances on interviews, one thing I tell people, if you get one invite, you're going to see you're going to start getting more as soon as you get one acceptance. Because I've seen one thing, I was one of them, is that people who get acceptances are like, there's a Matthew's law that 80% of the success is held by 20% of the people in the world. So 80% of people who get acceptances every year, they are just 20% of people. They keep texting me, hey doc, we got another acceptance from this school, we got another. And I just know it, that now balls will keep rolling towards them. So how do you become that 20%? I'm to be honest, there is a certain way to be lucky in life. There is certain way. Yes, you need to be a freaking hardworking person. Everybody's hardworking, but sometimes luck works towards you. The number one thing is, you need to understand that I will be fortunate, I will be lucky, but I need to go out in the world and expose myself to opportunities. So you have to knock a lot of different doors throughout US. So apply to more schools, so the chances of you getting an interview is more, and then the chances of getting an acceptance is more. And once you have one acceptance, you can tell the other school, like, listen, I got an acceptance from NYU, but I'm personally more inclined towards being in Washington. And I still wanted to know that if you're considering me as a candidate. And they will listen to you once they know you got an acceptance from NYU. So that changes your thing. Now, coming back to your specific profile, so the good thing you need to understand is that teaching for 4 years puts you in a better position, because that shows that you're somebody who's oriented towards education rather than making money. It makes them think that you value education, which you do because you were a teacher. The thing that you can do, which is lacking, when you say you have a good TOEFL, which is a good thing, because most candidates are stuck with TOEFL. The biggest problem right now, number one, is people are not able to score 100 in TOEFL. If I have a twin brother of mine, I'll tell him to go and start teaching TOEFL. I wish I could. It's not my thing to do. But if I have a lot of time and energy, I would start teaching TOEFL, because 80% of the people who are stuck in problems right now is in TOEFL. You're not, which is a very big thing, good thing. Now, what's lacking in your application right now, you only have 6 months of deership. Can you accelerate it? No. It's just going to take some time. Once you do at least 1 year of DA-ship, then people start taking you seriously. All right. That's when the fruit is ripened. All right. So one of the things that you can do is stay consistent with your DA job. The second thing you can do is take some good C courses, visit schools, do some C courses, some kind of uh, lectures, something in an academic recognized school. Go and attend those. So you can put that in your resume that you're associated with academic schools as well. All right. Maybe if you can do a bench exam at Buffalo or even Stevenson.
I did that with Dr. Stevenson this year.
So keep doing that. The main thing I'll say is that your DA-ship, it might take a little bit longer to make it look better. And now the next thing is, I recently made a video. I'm gonna post this. I made it last night. Is that I tell people is that doing things like, I'm giving an example which I personally like is like these bodybuilders, professional bodybuilders who do bodybuilding. Making muscles or building muscles is one problem. But when I talk to them or when I hear their interviews, they said building muscles is not problem. Posing them in the competition is so much more difficult. In the same way, doing something like all the academic stuff is the easy part. Now, the next part is how you're going to present your application, how you're going to write your personal statement, how you're going to communicate with the school. That's a very important thing because you have all the right things, you're working on it, but how do you put your story in a way that is audible to the American ears and make you stand out amongst the 800 people or 1,000 other can? So that's also a very important thing that you can work on.
Okay, doctor. One more question about my profile. As you said, like schools are looking for students. So I was thinking that my tutorship experience, does that put me in a wrong light that someone who is not that much willing to learn and they have already taught? So should I?
That's such a wrong way to look at things. I'm sorry. To be honest, you teach because you want to learn.
Right.
That's the whole thing. It's all about the worldview, the image. I grew up in the house of teachers, my whole family. My father was a professor, my grandfather was a convent teacher. I taught when I was in my BDS. And the only reason I love teaching more than clinical aspect is because you learn more as a teacher than you practice. Like it's more learning. So I don't think it's all about how you look at things and how you write it. So it shows that you had because our view of teaching in India, Pakistan is that we are going and cramming things and just throwing it at the student. From American perspective, you're doing research, you're actually trying new things, you're actually learning things while you're teaching. So I think you need to understand the weakness that you mentioned is one of the biggest selling point you have if you know how to write it down properly.
Because I recently got a rejection from.
Did they say we rejected you because you were
no,
a faculty?
No.
So what I'm trying to say, there is no weakness. It's all about, but you need to understand right now in the past 2 minutes, what I believe is your biggest selling point, you just thought of it as your weakness. So the way you're looking at things and then writing them might be one of the things. You need to rethink how you're presenting your ideas, because if I was writing your personal statement or your application, I would really focus on your teaching aspect and how it made you realize that the books I'm teaching are actually written by American faculty, by American professors, American dentists. And this made me realize that if I want to pursue more education, if I want to learn, I want to learn from the best. And that was one of the reasons I wanted to move to US. So it's all about how you phrase those thoughts. So I think your application is good. You just need to work more on your DA-ship and then maybe do some other things that are related to academic platforms. And I would highly suggest how you're writing your personal statement or your ideas will make a lot of difference.
Okay, doctor. Thank you so much.
Sure.
Hi,
Okay.
Doc. I just want to ask a quick question. So, on social media, we are seeing like mixed kind of things regarding a PhD. So, I'm currently pursuing my PhD. So,
Did you do a PhD call? Like, here's the thing. I first of all, what in which profession, which field are you doing PhD?
So, my research is related to environmental health, environmental epidemiology.
If okay, wow. First of all, amazing, very good job. Like my father was a PhD. I respect these people a lot. I say these are permanent head damage. PhD stand for permanent head damage. It's not easy to be a PhD scholar. But my question is, if on social media, I'm on social media. If I start making TikToks and Instagram reel that you should not do your PhD with because it's not worth it, will you leave your PhD? Will you
No,
drop it? Right?
I'm not going to drop. Like recently, I was reading in some groups that schools might not like when you have it.
Who the hell are these people to judge a PhD? Who the I it's sad for me that a PhD scholar is reconsidering about their academic path, listening from people on social media. First
No,
of all,
I'm not listening, but just want to, like in case if you are invited for an interview and your school wants to justify, like why do you had to go through that? Like why do you wanted to do a PhD after your master's instead of like directly pursuing something related to dentistry? I just want to know
because you were trying to. Here's the question. I'm gonna be okay. First of all, screw the social media people. Now coming to you, like we are gonna put the limelight on you. Your application has a very strong thing that's gonna work against you too. All right, it's look at things from a different angle. You're a person. When you start doing a specialization or a PhD, it's like you have one arm which is bigger than the rest of your body because you are super specialist in one field, but your other aspect of your body haven't been fed well. So one muscle is bigger than the rest of the body. So their question would be, is that you've been pursuing this PhD and you have not done any clinical things. So why do you want to come back to DDS and become a student all over again in clinical dentistry? Number one thing is, I don't know your application, but you need to start doing some clinical work, some dental assisting, some shadowing, some form of clinical hands-on work to show that even though I'm doing a PhD in the research side, but I'm also affiliated with the clinical aspect of things as well. That's the number one thing. The second thing is, now this is a problem when you come for interview preparation. That's when we can look into your application and we can see, but you can use your weakness, whatever you're thinking is your weakness is your strength, that you can tell that your whole life you've been a lifelong learner, and whenever you get an opportunity you like to get more education. All right? And currently you got the opportunity to be a PhD scholar in epidemiology because you feel that being a dentist and being a clinician and learning hands-on skill is very good, but along with that your ability to learn research will allow you to be an innovative dentist in future. And your long-term plan in life is to be a part of the teaching faculty at a dental institute where you can use your knowledge from the epidemiology world, from the research world, and assimilate it with your clinical skill. So you can provide good learning in the academic environment you're working in. So what I'm saying is that this is not first of all, the people who are talking to you, they don't have any idea. Second, I'm saying is that get some clinical skills, get some clinical experience so you can make your other limbs stronger. All right. Yeah. Then when both your limbs are strong enough, you can smash whatever you want to. Sure. So you're not at a disadvantage. You just need to add a little bit more things, and then your application will be more balanced. And in any interview, it's not that I did a master's in health administration, which has nothing to do with clinical work. It's administrative stuff. But once you can get some clinical exposure, then you can say, now I can use my administrative skill, my skills that I got from the master aspect and my clinical skill, and I can perform better than rest of the other dentists.
Sure. I had a chance to shadow a different dental practices like while I was doing my masters for some time, and during my PhD it started during COVID time. So like I could just get only like 6 months of shadowing experience. So do you think I would just
You need. I'm not gonna go into too much detail. I know everybody has life and they have all other issues going on. But what I'm saying, you need to get more clinical experience. Now, however you do it, you can. That's your life right now. You're studying in PhD. You might have family, all of other responsibilities. But as much as clinical exposure you can get it.
Sure, thank you.
All right, but these are not your weaknesses. You just need to know how to use them to your advantage. I forgot the actor's name. He's a British. He has knighthood. I would have to Google his name. He's in a lot of Christopher Nolan's movies. He's an old guy. He's been appointed as a knight, and he said, I was taught at a very young age that use your difficulties. He said, even in acting, I was taught that if you're entering into a room and somebody throws a chair at you, if it's a comedy movie, fall on it and make people laugh. If it's an intense drama, break that chair. He said one of the lessons I tell my kids, and he's a very wise person, is that whenever you have a difficulty in your life, you need to figure out a way to use that difficulty to your advantage. And if you're not thinking of life this way, you're not enjoying it. Like, you have to start, whatever you're having a trouble, wherever you are, start realizing, how can I now use this to my advantage? You have to. Otherwise, you're just going to get stuck. Like, you will be at a lot of disadvantage in life. All right. So any other question, guys? Dr. Shweta, any questions from you?
Dr. Adriel, I had a question.
Yes.
So I wanted to ask, I know that you said that dental assistant experience helps in your profile, whether shadowing or working as a dental assistant. I wanted to know if you are doing a preceptorship, like you said in one of your videos about UCLA preceptorship, what difference does it make? Does it does both add to your profile? Are both necessary for your profile, or one of them helps?
So there is no one answer, because they are not going to recruit 40 people or 20 people, all class of dental assistants who have dental assisting. They are not going to recruit all 20 people who just have preceptorship. They are not going to recruit all 20 people who have masters. They are not going to recruit all people who have PhDs. They want a diverse class, number one. Now, I was amongst the unfortunate who never did dental assisting, but I did a master's before I got in. I was at a disadvantage. I personally feel you should do dental assisting not just to show them, but to make your life easier. We as dentists coming from India, Pakistan, and other countries, we never made a temp for our patients. So if you don't know how to make a temp in dental school or take bite wing radiographs in like 5 minutes and all of that, your life will be so much miserable, which mine was, because I never did these things. I was a oral surgery resident, who cares, like that kind of attitude. And when I had to make temps, it still annoys the hell out of me. So dental assisting will just make your life easier, because in school, most of the things that we are doing is a dental assisting work. We are like, so that's number one thing. Now, if you say in comparison, which is more powerful, doing preceptorship or dental assisting, the point is, some people have visa issues where they can't do dental assisting, right? Will they get accepted? Yes. If you can't do dental assisting, do preceptorship, do shadowing. So there's no right and wrong. It's just about whatever the key thing is, you need to understand, I made the best out of whatever opportunity life gave me, And this is what I learned out of it. When you write your application, it's all about expressing your thoughts. Now, two people might have done preceptorship. One person might write, I did preceptorship where I got to shadow the resident, I see the discipline, I see how the faculty work, and I got to learn, and it learn about dentistry, and it encouraged me to become a dentist in US. This is how one person wrote about their preceptorship. Now, on the other hand, the other person wrote is that I was fortunate that I got to do a preceptorship, which was a learning curve because I got to learn the importance of patient confidentiality. I got to see how they use Axiom, how they use Epic softwares. I got to attend their clinical pathological conferences every week and see their discussions and how they do research, and most importantly, how they communicate with their faculty, with their peers. And this is when I got to have somewhat of a basic understanding of the lifestyle of a dental student or a resident. Now, the second thing that somebody wrote is much more detailed and are things that the school wants to hear. So, is dental assisting more important than preceptorship? Maybe yes, maybe no. But by the end of the day, if you have either one of them and you know how to write what you learned out of it, that's what matters. So, for your answer, if you can do dental assisting, I would definitely suggest it's good for your own skills. But even if you did just preceptorship, but you know how to write what you learned from those experiences, that's what matters. Does this answer?
Yes, sounds good, Dr. Adriel.
Okay. Any other questions, guys?
Doc, I have a question, a follow-up question to Dr. Zabeen and Dr. Manse's question, where they thought that their weaknesses in their profile are weaknesses, but from your perspective, it's their strength. So how one can determine that any weakness, like according to me, it can be weakness in my profile, but according to your perspective, it's a strength. So how can we determine that?
I don't have an exact answer to that. It's just I just learned this out of experiences of life. Like it's just you know why most people come to me or like pay me to work with me or something like that, because this is what I do. I try to listen to their story and try to figure out there are certain things I'm not a magician. I can't fix your TOEFL. If it's below certain score, we can't change it, right? But there are things which are perceptions, it's a worldview, because we are seeing things as Indians, as immigrants, as Pakistanis, and we need to start seeing things as from American point of view. And how do you do it? I don't know. It's just with my life experience, this is what I do. I try to listen to people's story. I work with them and try to figure out how can we use your weakness to make you a stronger person. How do you learn it? I don't have a definite answer. There's a lot of content on YouTube. I don't know. Maybe I've read a lot of psychology books, a lot of American art, like watching. I don't know. I don't have a fixed answer to that too. It's just you listen and you try to see, okay, do this. Write down wherever you have the biggest weakness in your personality. All right? Whatever the flaw is. And try to see if it's fixable or not fixable. Is it controllable or not controllable? For example, you have a low GPA. You can't go back in time and fix it. Right? But now you got to focus on things which are controllable. Maybe your TOEFL score is less, work on it. If your dental assisting is less, work on it. All right. So that's the way I would look at things. Is that making sense? Because it's a difficult answer for me to. I don't know how to teach somebody. It's just out of experience, because this is my job. I've been talking to so many people that over time, and I've studied in a school for so long enough that I know, okay, school, and I grew up in my father used to teach in an American college, university in Pakistan. So I grew up in a campus, and my next door neighbor was a chaplain from Tennessee or professors who were coming from US. So that's the kind of environment I grew up. So for me to understand a little bit how teachers think or how schools think is a little bit like that's how I grew up. Does that make sense? So
Yes, doc.
when I went to dental schools, it's like and collecting information, listening to people, listening to the faculty. That's what gave me an idea. What are they trying to look for? Like what are they looking for? Does that make sense? What I'm saying? Like I know I don't have a very good answer for this, but I tell people interviews is like a dating, how you date, how you go to for a date between a man and a woman. It's kind of like the school is looking for an ideal student, right? And the ideal student is looking for a school. So you have to present yourself in a way, yourself in a way that they like you. That's it.
Right. As it is said that having research experience, it boosts our profile. So, like, I have done my master's in prosto from India. I had my thesis over there, but I'm not a person who actually wants to do research. I'm more of a person who is inclined towards the clinical experience and working with the patients. So, like, how can I present that in my application? Like, even though I have thesis or
So
MD.
just to back it up, I never did a research in my life. I've never done it until now. I'm not proud of it, but it's never been my cup of tea. I just never got an opportunity. I never did. Maybe in future I will if I get the opportunity, but it doesn't mean the schools didn't like me. Like I got accepted to 4 of them without a research. So you don't even have to defend yourself. So like just focus on the things that you like to do, write about those and the things that you want to learn. You don't have to be okay. If you failed in your INBD twice, yes, you should defend it. You should give a reason. But if you never did research, it's totally fine. If you never did a preceptorship, it's totally fine. Just focus on the things that you did in your personal statement and talk about those.
Okay.
All right. Dr. Safa, you're asking if the DA
Thank
ship
you.
is
Okay.
old. You're asking if the DA ship is old. I don't know if the D experience is old. What matters is that are you still, what they want to see is a consistency in your application, even if you had a break or a gap in your life due to responsibilities, but they want to see that you're back in the field or you're still connected and you're still like in the field. So if you had an experience, you stop, go back and start doing something clinical. So you can show that I'm back doing the things that I love to do. So let's go back to Dr. Sukhbir. All right, let's come back. All right. You were asking me about the interview part, about your tell me about yourself.
Just one more question before that. Sorry, doctor.
Yeah, go ahead.
Uh, so my experience, like I did my master's in administrative sciences here in Canada, and after that, like I had the opportunity to work in hospital, but I just wanted to stick to dental office. So I started working as a dental receptionist, and then later, right now, I'm working as a dental office manager at different office. So as such, I don't have like direct experience with direct
Clinical.
experience with patients as such, like no clinical experience here in Canada. So how this thing gonna affect
It
my
it will affect you if you can now start doing it, do it. If you can do it now, if you can ask one of the doctors you work with, if 1 day or 2 days they can let you come back and do some radiographs and work or do something like that, whatever they can allow legally, because I know Canada you need certification, but
Yeah, when I was like, when I started that time, I started as like chairside assistant. I
yeah,
know how
but
to do radiographs.
the point is if you can ask them to keep you like 1 day, let you work on it so you can put it in your resume and letter of recommendation, that should be sufficient enough.
Okay.
Right. So if okay, coming back to your tell me about yourself part. All right. So can you let me fix something, and I'm gonna ask you this question about your tell me about yourself, and you can let me know something. Let me just fix one thing really quick.
Okay.
All right. Okay. So go ahead. Tell me about yourself, Doc.
So my name is Sukhbir Kaur. I'm 29 years old, and I belong to a very small village. It's in Punjab, India, and I'm because I was related to a very small area where education was like educational facilities not were not very good. So I had to move to a boarding school. So most of my schooling till my high school is from a boarding school, and later I got the opportunity to get into a dental school after my high school. And in 2017 I passed out from the dental school, and with the help of my faculty I started working at the same school as a mentor for first and second year students for preclinicals. And later during that time I was also working as just part-time associate dentist at a private practice. And in 2018 I decided to move here in Canada for my further studies, and I took admission into masters in administrative sciences with global health here in Canada. uh, and after finishing that, most like I had the opportunity to work in healthcare sector as admin in Canada, but because I was so dedicated to be in dental field, so I started working as a dental receptionist at a dental office in Surrey here in Canada. Recently I got hired by another dental dentist as a dental office manager in 2024, and right now that's pretty much about me.
Okay, so you said you grew up in a small village or a small place in India, in Punjab. What was the name of this place, Doc?
uh it's Malot. I don't know. We must know.
It's which big city is it close to?
So the closest big city is like 2 or 3 kilometers away. That is Chandigarh.
2-3 kilometers is not far.
200, 300 kilometers away.
Okay.
Sorry.
Okay. So closer to Chandigarh. Okay.
Yeah.
And if you don't mind me asking, what profession were your parents in? Were they in farming?
Oh yes, my father, he's a farmer, and my mother, she's a housewife.
And your grandparents were in farming too?
Yes.
Like agriculture. Okay.
Yes.
And how
yes.
many siblings are you?
Just one brother.
And which field did he go into?
He's here as well. He's an electrician here. He owns a company now.
So what made you go into dentistry? How did you land it up?
Because I was the only one person who went to boarding school, and my whole circle.
What was the name of the boarding school?
It's Jawan Vodya Vidyalayas. These are like free education school in India.
Okay. Okay. And what made you move to Canada? Like, okay, fine, you went to this boarding school, you went to dental school, now you're a doctor in Punjab, right? A big thing, but why move to Canada?
So my brother, he moved before me here. Like, of course, the area where I belong to, it's not like opportunities wise, it's not a very good area. So instead of just moving to some other city for jobs and stuff, so my parents decided like you guys can move to Canada. So first my brother moved here, and then after almost 1.5 years, I moved here to Canada.
So beside this, okay, this is your academic part. Then why did you do a master's in global health? What made you go?
So I just had this option because I had to move
student visa.
Yes, yes.
Okay, so okay, except for the academic part, what else did you like to do when you were growing up? Were you in Bhangra? Did you do any sports? Did you help your parents in agriculture, or what were the things of your life that?
So most of the time I was in boarding school, starting from 6th grade to 12th, and during that time I was a volleyball player. So I did played like a nationals for my school and like for my state in volleyball.
Any other aspect of your life that you would like to tell? Something stressful, something life changing, something different that you dealt with, whether it was your dental school or anything like that?
So yeah, so the question you asked me earlier, like how you decided to go into dentistry, like when whole of your family was from a totally different background. So because I was in a boarding school, so that time, like, so my parents never forced me to take any decisions. So these are all my decision for like going to healthcare and this.
Who influenced you in that boarding school? Who was your biggest influence up there when you were there?
I my parents even like my one of my teachers, she just asked me to fill this form and go for this test. It was in the same school where I was studying, and I took the test and I got in. There was a like selection criteria going on during that time, and I just got in. And for next 7 years, I was studying like free of cost.
Okay. Were you really good at your grades and stuff?
Yes, like I got 99% in that test when I got in.
Okay. All right. Except for this, except for your volleyball, like there's some other things I don't want to go into too much detail since we are in a group setting. Just to, yeah, there's some other aspect I would like to ask you, but I'm not going to ask, but just to go from the information that you gave me, Doc. So you pronounce your name Sukhbir Kaur?
Yes.
It just reminds me of the singer, you know that, right?
Oh, yes.
Okay. All right. So if I was you and they asked me, tell me about yourself. Okay, go ahead, ask me, tell me about yourself.
Okay. Tell me about yourself, Sukhbir.
Thank you for giving me this opportunity. My name is Sukhbir Kaur. I was born and raised in an agriculture family, which I grew up in a very remote area of Punjab in India. It doesn't have much facility when it comes to healthcare and education. But I personally was very much inclined towards reading at an early age. And because of that, my parents were able to send me to a boarding school to a nearby big city. And I think my life took a very big turn when I was shifted to this boarding school at the age of 12 because I got to interact people coming from very diverse background, children coming from all socioeconomic status. And during that time, I found some teachers who were willing to work on me, who encouraged me in education and in sports as well. So over time, I developed a very big interest in playing volleyball, and which led me to play for national team of women national team from India volleyball as well. But it also gave me a good understanding and an interest in the field of biology. And one thing led to another. I was fortunate that I got inclined towards dentistry and got accepted to a really good dentist school in India, in which not only did I get to learn didactic, but also a lot of clinical dentistry as well, especially working with low socioeconomic status people, especially people coming from farming community. And I was able to serve the same kind of people where I grew up. But I personally felt there was more to life. I wanted to learn. I remembered the words of my boarding teachers, my school teacher, that if you want to learn more, you would have to take risks in life. And that gave me an encouragement to pursue a master's program in Canada in 2019. I moved to Canada and started pursuing a master's in global health, where I got to get some understanding about healthcare system in the North American region, how the education system work, and along with that, I got to see how to interact professionally with my peers, with my faculty, use technology. And after graduating, I have been working in a hospital setting as a healthcare administrator. Beside this, I also got the opportunity to work as a dental assistant. And currently, I also serve as an office manager at a dental office. And throughout these different experiences, not only did I get to see the insurance aspect, the administrative aspect, but I also got to see the importance of patient confidentiality, how hands-on clinical dentistry is done in the US and in the North American region. And beside this, I still like to go for hikes. I love to run whenever I can. Exercising is my key to deal with stress, and I like to cook and dance whenever I get the opportunity. So somewhere around that ballpark, if I was thinking about your life story and we had to create a tell me about yourself, that's how I would put it up. Now you can remove some detail, add some details, something like that. But these are from the given information that you gave. right now, and obviously we are in a group setting, these are the things I feel were the most important ones.
Okay. Thank you so much, Doctor.
All right. Okay. So beside from this part, guys, I won't be able to do it for everybody because it's a lot of energy. It just when I'm listening to somebody's story, I have to imagine myself like them, and then to think, and it takes some energy out of me as well. But beside the interview part, do you guys have any other questions, like from Capit, from application, or these kind of things?
Hello, Doc. Can you hear me?
Yes, loud and clear, Sarah.
Okay. So before I ask my question, I would just like to give in a brief about myself. I recently graduated from UCMP, and I'm currently enrolled in my house job, which is the internship. So my question to you is that are the dental schools in US, do they prefer a candidate who has done a master's degree from their hometown, or would they
They
prefer,
prefer a
or would they
people.
equally
uh,
consider a candidate who just simply
Here's
had
the thing, they prefer people who are inclined towards education and who are hardworking. Now, there might be a multiple ways to express that. You can do a master's, you can do residency, you can do more clinical work. There's different ways. There's no one single route. You just need to see what's more possible for you to do. Because if you're sitting in Pakistan right now, visa is the number one thing. All right, if you figured out if I'm will be getting a visa, like there's a lot of different aspects. So my answer to somebody at your stage is to do the best whatever opportunity you can get. When I was in your situation at that time, I got to know the biggest dogs hanging around is FCPS, the people who do postgrad under College of Physicians and Surgeon in Pakistan. So I prepared for that exam, I gave that. So there's no right one answer in your situation. Just pursue the toughest thing in the best manner you can right now.
Okay, thank you, Doc.
All right. So Jagriti, what's your opinion regarding sending a thank you? I don't have an opinion. You can send an email. There's no harm in it. Just don't waste your time. Just write a brief. So Doc is asking, should we write a thank you email for after the interview? Well, if you are thankful to them, you can write. Just keep it brief. Don't write a very long email. That would be my suggestion. So there's no harm in it. Any other question, guys? Dr. Aisha, you're going to say something? I can't hear you. Maybe if you're saying something. Okay. Any other question, guys? It can be regarding other aspect of Capit, anything like that. All right. I think nobody has more questions. I will stop the recording. We'll post it today or tomorrow whenever I can and share the recording. If anybody still have any question, let me know. I can even stop the recording if you guys want me, and if somebody wants to ask a question or two, they can. Okay. All right. I'm going to stop the recording. If you have any questions, you can ask me. Okay. So, one thing I'll tell everybody, do yourself a favor, do the school a favor, get savvy with technology. I'm telling you, there are a lot of people who are not very good dentists, who are not very smart with biology, but they get opportunities, they get acceptance, they get in places because they are very good with technology. I know people who screwed up their interview because they were not able to get the internet right or something happened. I'm just telling you, in US right now, the way systems are changing and it's becoming more and more AI and everything. If you do, and we aren't young people. We aren't 20 years old. We are older now, like middle ages, kind of like that. My suggestion is invest more time in getting used to with technology. Even I run a YouTube channel and I still feel I'm not very tech savvy, and it caused limitation to my growth. Like I don't know a lot of things with YouTube and stuff. I don't have the energy because I have other things to do in life. But there are, like, for example, a lot of people on Zoom put on some professional pictures, headshots. Like right now, if you look at my picture, it's not very professional. It's a scary picture that I have, but have professional pictures on your Zoom. It's like a professional ethics. So get used to or accustomed to technology as well, because that will really help you in the process as well. Most people, candidates I work with, I'm working with their personal statement, and they will say, how do I save a Microsoft document? I'm like, I can't teach you computer. Like, I can tell you about dentistry or dentist school, but I'm not going to teach you about technology at this point. Go Google it. So if you're communicating, you're working, these processes will become easier for you if you get more and more used to with technology as well, right? So let me see if Dr. Aisha, if you wrote down the comment. No, you didn't. Okay, any other question, guys, before we leave? All right, okay. Dr. Aisha, I'm going to stop the recording, all right, guys?